Hi everyone, my name is Ann Alton. I'm coming to you from Professional Therapy Services at Unity Point in the atrium. And I'm on my phone again, and so I'm probably going to be looking in the wrong direction. But today I wanted to talk to you a little bit about the nociceptive inflammatory pain, which I had promised you last year. So basically, I wanted to talk to you about what inflammation is first. So inflammation is basically what I call the body's repair crews. So anytime we have an insult or an injury or a long-standing issue, we have repair crews that come to the area to basically add the positive, good materials to rebuild, and then take away all of the old bad materials, waste materials, and so forth. And in that process, a lot of extra water is needed to hold all of those extra proteins and lipids and chemicals and all of that. So in that soup is also histamines and cytokines and all of these different kinds of chemicals that actually make our nerves fire more frequently. It's painful. So if you think about, you break your arm, you're definitely going to feel it, and the inflammation is going to make you remember it's there. It's going to throb. It's going to feel like, okay, don't do anything with this arm, not too much too soon. Okay, it's going to keep you from back. And so I think of those inflammatory markers and those painful chemicals as being like the flaggers on the repair, in the repair zone. Okay, so they're going to just kind of slow you down and make sure that you don't do too much too soon. So basically, a flare-up is increased pain, at least 2 points on your normal scale. Like, so if you're normally running at a 5 or a 6, flare-up would be maybe an 8, okay? And it lasts more than 1 day. Symptoms can include any of the following: redness, pain, warmth, swelling, loss of movement, loss of function. Inflammation is a sign that your body is restarting that repair process after a flare-up or an injury. The body's cells release these chemicals to alert your nervous system, which says, hey, we're healing. We need to slow down so that we can heal. Okay, once this chain begins, you have entered healing stages, okay? The injuries may cause inflammatory pain is either trauma, normal, breaking your arm, twisting your ankle, that sort of thing, but it can also be overactivity. And so those of us who have chronic pain know that if we do things for too long, or we overdo it, we clean too many rooms in our homes, or we do too much in one go, for 2 or 3 days afterwards, we're really, really paying for it. That tends to be more of the inflammatory pain. Okay, it can also be muscle sprain, joint sprain, bursitis, arthritis, those kinds of long-standing kinds of issues. What does it feel like? It feels like it's in a specific pinpointed location. You can say it hurts right here. Okay, you may have muscular or joint tightness around that area, so you may feel stiff. You might have some swelling or edema. I see swelling, or I feel swollen. You might not see it. You may not feel warmth and redness, especially if it's a long-standing issue. But a lot of times, your clinician, your physical therapist can put their hands on you and go, oh yeah, you feel swollen. You feel, boggy. If you've had joint trauma, you also may see, I hear cracking, I hear crackling, I hear, kind of what we call crepitus. The things that you can do, it's important to recognize the type of pain that you have and what may have caused it, so that you can seek professional help with it. If you need a new diagnosis, sometimes we know. It's like, yeah, I overdid it yesterday, so my back is ticked off. As you progress through your healing, you can expect it to work through the following stages. So the first one is the inflammatory stage. This is weeks 1 and 2 after your injury or your flare-up. For the first 72 hours, it's important to use mice. So you've heard rice, rest, ice, compression elevation. We have changed that. Okay, now it is mice, so it's movement instead of rest. Ice, compression, elevation. Okay, and movement is not your typical like, oh, I'm going to go running. No, it's gentle, pain-free range of motion, but just enough to kind of get the juices flowing. Okay. Movement is recommended within your tolerance. Remember, pain is your guide in these first couple of weeks. Recognize your baseline level for tolerance of daily activity. Move only in those mid-ranges. Don't try to overdo or overstretch those muscles or do too much activity. Refer to your flare-up plan for additional strategies. Hopefully at some point we will do one on flare-up planning because that'll help out quite a bit. So the proliferation stages, these are 2 to 4 weeks after injury. Your body's starting to build scar tissue. It's important to really work through those mid ranges or pain-free ranges to stretch and strengthen that scar tissue in the ways that you're going to move it. Okay, remember, no worse now is your guide. So before we didn't want any pain, like we wanted no pain or no increase in pain. And so now no worse. We don't want to increase the pain with tasks and exercise. No worse is defined as having the same or lesser amount of pain after the end of the day or after you do your exercises. If your pain lasts until the next day or longer, you're having another flare-up, you've done a little bit too much, you just need to back off. You're probably still safe. Okay, you probably haven't done any major damage. Usually the damage comes with the oh crap moment. But work with your clinician to find out what a good pacing strategy is for you if you're having trouble finding this. You can also use heat to help reduce your pain and promote tissue healing. But you can check with your healthcare practitioner because sometimes that's not, it depends on the person. It depends a lot on the situation. Weeks 4 and beyond, you're in the final stages of healing. It's important to keep a close record of your tolerance to activity and exercise and look for potentials to increase your function. Okay, start working through the end ranges of motion and continue to strengthen your scar tissue to re-educate your once injured tissues. Muscles and joints can begin to take heavier challenges and increasing strength at this point. Remember, no worse is still your guide, okay? We don't want to flare it back up again. To feel pain at the end of movement is good, and it'll strengthen, but your pain should get no worse as a result. So you should be able to feel like, okay, so that kind of hurt, but as soon as I stop doing it, now we're back down to baseline, okay? Inflammatory pain can also respond very well to anti-inflammatory medications. And you can talk with your doctor or your pharmacist about what's okay for you to take at this point. Basically, this all comes from the book Managing Your Pain Before It Manages You, and that is written by Caudill. Okay, so basically also the other thing that wasn't mentioned in that write-up was that for long-standing inflammatory pain, we tend to feel worse in the morning, like we feel like we can't get out of bed, like we can't move. And then the other is that we tend to feel like we get worse towards the end of the day. So you may feel worse at the beginning of the day, better as you start to get moving, and then after you've been moving for a while, it starts to get worse again. That's a pretty common pattern for that pain. All right, so click all the things, the bell and the subscribe and all of that, and then leave me a comment below if you have any questions about what I went over today, and then hopefully next time we'll go through some ischemic pain or some other types of pain. All right, I hope you're having a great day. I hope that the holidays and the change in the weather is treating you okay, and take care of yourselves. Thanks for watching. Bye.